Um, Hello, everyone. Thank you so much for joining us today. Before we begin, I would like to start with acknowledgement of country. I would like to acknowledge the traditional custodians of the lands in which we meet and work and live. I'm currently on the traditional lands of the Bannerang people in the western suburbs of Melbourne. And as we speak of mental health today, I would also like to recognize that Aboriginal and Torres Strait Islander people experience higher rates of mental health issues and suicide due to intergenerational and ongoing traumatic effect of colonization. Today, I am honored to speak with Maggie Toko, a mental health leader and lived experience advocate. Maggie is well known for her work amplifying the voices of people with mental health lived experience and shaping mental health systems and policies. She's also currently the commissioner at the chair commissioner at the Mental Health and Wellbeing Commission in Victoria. Maggie, is there anything else you'd like the audience to know about you today?
Well, kia ora everyone, and I'd like to acknowledge the traditional custodians of the land which I'm meeting today, which is the Wurundjeri people of the Kulin Nation. Acknowledge elders past and present that land was never ceded, always was, always will be Aboriginal land, and recognise those of you in the audience who have a lived or living experience of mental health issues, and for all the work that you are doing and our allies are doing for reform. I might let Maria have her say first, and then I'll start.
And look, Maggie, hello everybody. Maria Demopoulos, CEO of the Settlement Council. Maggie, I just really am going to be in the background listening intently as I learn even more from you. I've known you for a fair few decades, but I so respect the work that you do. As I said, I'm here to listen and learn and to convey the very strong message to our sector that whilst I think we have worked very hard to ensure that issues of mental health and wellbeing are really embedded in service design and delivery, particularly to newly arrived communities, that it's still something that we need to do better. And that the more we have these kinds of conversations with people such as yourself, the more likely we are to ensure that those gaps are addressed and that long-term standards, I think, of service delivery in relation to mental health and mental health issues improves, but really centering that point that I know you make so well and so powerfully is centering lived experience at the heart of that service design and delivery. So thank you, Maggie. I'm certainly very grateful on behalf of the sector that you're here. I am going to hand it over, as I said, to Iga as our policy lead on these issues, and notes will be taken and learnings will be made. Thanks again, Maggie. Very grateful.
No worries, thank you.
Maggie, when we met a couple weeks ago to discuss ideas for this video, you said something important that really stuck with me. You said that when we talk about stigma, the more appropriate word to use is discrimination. I am really interested to hear more about that. Could you tell us more?
Sure. Before I get onto stigma and discrimination, I might just talk a little bit about myself. So I have a lived experience of mental health issues. I have what's called paranoid schizophrenia. This means that I hear voices 24/7. I hear homicidal voices telling me to kill people, telling me to maim people. It makes me very tired, so because I hear them all the time. They yell and scream at me throughout the day. Only when I'm asleep do I not hear them. But what this means is that I have a psychiatrist who I see on a regular basis. I take medication. I'm on the depot injection. So I have that once a fortnight and it's administered by a GP. It has interfered with my life periodically for a very long time. But throughout my life, I've worked all the time. I started off as a youth worker and worked with young people in the Western region of Melbourne. And then I went on to do management with the Salvation Army for a number of years, again in youth work. Then I went to be CEO of the Victorian Mental Illness Awareness Council, which is a peak body for mental health consumers. And then I went to the Commission, first the Mental Health Complaints Commission, and now to the Mental Health and Wellbeing Commission. So one of the things I do in my life is I tell my story quite often to huge audiences. And I, in particular, like talking to young people. I like talking to community members, to consumers, because I like to be able to say there is hope, even when you have a mental health issue. And even when you're in your darkest days, in your darkest times, there is hope that you can not necessarily overcome it, but you can learn to live with it. It's just one component of who you are. It is not the sum of who you are. And that's where stigma and discrimination come in. Stigma, there's lots of stigma in the media. There's lots of stigma to the general public about mental health issues. Often we are seen as people who are dangerous. The media often pick up stories of murder and mayhem when somebody has had a mental health issue and had a mental breakdown, and they raise that, and so the general public think that's the whole of who we are, that we're dangerous, that we'll hurt people. Now, I know I said that I have homicidal voices, and sometimes I've nearly acted on it, but I never did. I never did. That doesn't mean that everyone is like that, but generally it is. When people harm people or come to that stage of harming people, it's usually because they've tried every avenue to get assistance and they haven't been given assistance. So stigma is really about holding people down. It's about making untrue statements about people with mental health issues. The leaders in the lived experience space prefer to use discrimination rather than stigma as a word. Discrimination because it's against the law to discriminate against somebody. So if you have a family member who has a mental health issue, or you have a mental health issue, it is against the law for someone to discriminate against you. You need to know that. It is your right to be able to express yourself. There are issues around discrimination, though. In the Mental Health Act, so Victoria has a Mental Health Act, and in that Act, there are 13 principles that every mental health service and wellbeing service in Victoria have to pay attention to. And there are principles around culture, there are principles around cultural safety, there are principles around your right to speak up, to have your say, to make your decisions. So the commission that I work for have had a project on the principles, and we have made them into plain English language, and some time this year we will probably translate them into other languages, so they'll be really relevant to you and they'll be really simple to understand. And you'll be able to, if you go into a hospital service, or if you know somebody who's in a hospital service, they have a right to say, are my principles being listened to? Are they being enacted? And when we translate them, that will make it even clearer for you. There are issues around language with stigma, but I'll talk a little bit about language around mental health. A lot of people think that mental health is a Western concept, so that only Western people have mental health issues. Now, this is just not true. This is just not true. It goes across all cultures. And there are similarities to the mental illness across all cultures. It doesn't mean that the diagnosis that you're given is what you actually have. Diagnosis is a Western concept. Okay, so you might have someone in your family who's a bit different, a bit sensitive, who may get upset with noises, who may get upset with crowds. That doesn't mean they have a mental illness. It just means that they're sensitive. But it depends on situation. Lots of things build on top of each other before you're diagnosed with a mental illness. If you never go into the system, into the psychiatric system, so if you never end up in a hospital, it's unlikely that you'll end up with a diagnosis. Diagnoses usually happen when you go to hospital or when you come into contact with medical people, doctors and so on and things like that. Really, there's lots of stigma around being treated in a mental health facility. Many families of all cultures experience this as a very strange happening. It's very different to be in a psych ward. It's very different to come into contact with psych services. Many of those services want to assist you, though. Don't be afraid of them. Sometimes things happen in them that you don't want to happen, though. But you have a right to ask what is happening to you. You have a right to know what's happening to your person, to your body, to yourself, to your family. Your family have a right to ask. Your family have a right to know what's going on with you. You don't have to do this alone in a space on your own. I might hand it back to Inga in case she's got other questions.
No, thank you so much. You've shared so many important things that I don't even know like where to start because there's just so much. But I thought it was really important how you talk about culture and how mental health is not a Western concept, and also like the language and diagnosis. And I feel like a lot of times, like the language we use, for example, when we talk about migrant refugee communities and how they like carry stigma or how it's like attached to like cultural stigma, whatever, like it shifts that responsibility onto them. And then like I've personally heard so many things like, oh, like you're difficult to engage with, or you're like treatment resistant, things like that, when actually like you don't know how to engage with me. So like, like we're shifting that responsibility onto people with lived experience instead of like being like accountable. And yeah, so many thoughts on that.
Well, I think, I mean, we live in a colonial society. Let's name it for what it is. We live in and with colonial societies, there are lots of power dynamics.
Mhm.
And there are people at the top and there are people at the bottom. And it shouldn't be like that, but it is like that. So we have a system that by all accounts, depending on who's in power, which government is in power, they will they will take the opportunity to empower the people. They will take the opportunity to make rules and regulations that assist people to live and grow. But this doesn't always equate to everybody, because not everybody is equal. I wish people were equal. I wish people were treated how they really deserve to be treated. But this doesn't happen because we have a system of power dynamics. So when somebody is experiencing stigma, it's quite easy to put it onto them. They're the one that's at fault. They're the reason that there's family violence. There's the reason that there's racism. They're the reason that there are eating disorders and all those kinds of things. But it's if we look at it from a system perspective, which is society puts a lot of onus on individuals to take self-responsibility. And I'm not saying that's a bad thing, but in some situations, people are the way they are because of the system that they live in. They haven't asked to be in that system. People haven't asked to be homeless, because the fact is there's not enough housing, and there's not enough money in the economy to make houses. So you have homelessness. You have unemployment because there's not enough jobs around. There's not enough money going to the economy to make jobs. So there's unemployment. Family violence. There are power dynamics in family violence. The perpetrators of family violence are usually people with histories of anger. I'm not going to say that it's gender specific, because I want to be really mindful of that. But the fact is, more men commit family violence than women. That's not saying that women don't commit family violence, but more men commit family violence. More women are killed during episodes of family violence. That's just the data that we have. I'm not saying that it's only women who die, but more women die. Children, the rights of children are very minimal. And certainly in my time as a youth worker, I have championed the rights of young people and of children, because nobody listens to them. We live in a society that doesn't value children. And when that happens, it explains the systems that we live within. So it's time to stop blaming the individual and look at the systems that we live in. For mental health consumers, there is a system that has power over the choices of mental health consumers. It just is. It has been like that for many, many years. Psychiatry pigeonholed men and women and children with mental health issues into certain categories. So that's where you end up with a diagnosis. It's just historical. It doesn't mean that diagnosis doesn't exist. Like I said, I've been diagnosed with paranoid schizophrenia, It just so happens I have the characteristics that other people with similar illnesses have. But it is only one component of who I am. It is not the sum of who I am. So if you have someone in your family who has schizophrenia, or you have been diagnosed with schizophrenia, it is not everything that you are. You are more than that. Just remember that. But those are the parts about the system, Ego.
Yeah, absolutely. No, thank you so much. And also, the question I wanted to ask, which you kind of answered earlier, like with all of that, and you talk about like the power dynamics within the system and that, you know, like medical superiority over like lived experience, how like medical professionals obviously have a lot more power than people with lived experience, and those imbalances, like what is the role of the mental health and well-being commission, like you as a lived experience person, like what is the value of lived experience leadership? If you could tell us a bit more about that.
Well, I'll tell you a little bit about the commission. So the commission itself has oversight of every mental health and wellbeing service in Victoria. So ensuring that the principles are used, ensuring that human rights, that the services are human rights focused. We have a complaints arm attached to the commission. So if you are a patient in an inpatient unit, or you are somebody who uses mental health services, and you feel that you haven't been listened to, that you haven't been heard, or that you have a complaint against those services, then you have every right to ring us up, ring us here at the commission, and complain. A worker at the commission will talk to you over the phone. You can email, you can ring. I will give Inga the details of the Mental Health and Wellbeing Commission so that she can put them on site on the in the notice, in the notes.
Yeah.
But you can complain, and somebody will get back to you, and they will talk to you. They will find out what your complaint is and how you want it resolved. For some people, they want it resolved. They want the service to apologise. Services may take their time to apologise, but most services do, because they don't want to cause harm. Services don't want to cause harm. So, and sometimes the complaint is because there's been a misunderstanding, and services will work, and so our staff will work through what those complaints are about and try and come to a resolution. Okay, so that's what happens. That is if you use a public mental health system. If you use the private mental health system, because there is a private one, if you use a private one, then you go to the Health Complaints Commission, not us. But our workers will tell you which commission you're to go to, and they'll give you the details of that if you ring us and it's not us. The other thing is that I'm available to have a conversation with any consumer in Victoria. I've made that commitment. And there are many consumers who ring me, and we have a yarn. Sometimes they ring with complaint. Sometimes they ring because they want to know about a policy or a procedure that we're doing. Sometimes they just want to ring and say hello. And it's okay if you do that. But the commission is there for all mental health consumers and family. And the Mental Health and Wellbeing Act has mentioned families within the Act. So as a family member, you can make a complaint as well to the commission It's not just for the person who has mental health issues. You can make a complaint if you've been treated unfairly and if you've got something to say about the mental health system.
Thank you so much, Maggie. So much important information that you just shared that we're going to share with our members as well. And yeah, what an important work you're doing. Thank you. Thank you so much. We might wrap up here, but also this is such an important conversation and I would love to continue it and continue talking about all those different things that you've mentioned today, because I really think there is so much that we still don't really talk about, but we should. So yeah, again, thank you so much, Maggie.
Sorry, because I can't help myself. Every time I hear Maggie, I want to hear more, of course. But Maggie, if there was one thing you think there'll be many settlement services that are listening and really trying to think about how they might take on a lot of what you've said and embed it. We keep talking about embedding these things. But if there was one simple thing from your perspective that would really make a difference to someone using their service who is experiencing mental health challenges, I hope I'm using the right terminology. They're not challenges. I mean, as you said, they're part and parcel of who we are. But if there was one thing that you think we could do to make a slight difference in the lives of consumers or people with lived experience in our communities, what would it be? I know it's never just one thing, but one thing that in your experience has made a difference.
That's easy to answer because look, I think that the leaders in your community, and I know there are many, and I know quite a few of the leaders within your community, is to hold the hope. Hold the hope for consumers that their life can be different. If leaders don't hold the hope, then what hope has anybody got? So for leaders, it's the easiest thing to do, and yet it is challenging. I know for the leaders in your community, they're up against a lack of funding, they're up against a lack of resources, they're up against stigma and discrimination within cultural spaces, but you must hold the hope. It is one of the key components, and it's something that I've always promoted because I've seen where it works. And there's this thing that I do that I have done for many years working with individuals is I'll say to them, I'll hold your hope in my mind until you can hold it yourself again. And what I mean by that is often when people are lost, when people are worried, when people are stressed, when they have no money, no home, and it looks like they have no future, they give up. And so I'm saying to them, it's okay for you to give up, but I'm going to hold the goodness and the kindness about you in my mind. And when you're ready and able to see those things again, I'll be here for you. So I'll hold the hope. And that's what I mean.
Thank you
so much.
Maggie, thank you.
Yeah.
Okay, thank you. Thank you both.
Thank you so much. Thank you.
Hey again, this is Iga. I just wanted to record some final thoughts in the end. I became very emotional interviewing Maggie earlier this week, and I think it's because it was such a powerful and meaningful interview for me personally. And I am just so grateful to Maggie for sharing her time and her experience, her lived experience and vulnerability with us. And I just wanted to add a couple thoughts because actually when we finished recording, we continued sharing some thoughts off screen, and I thought it was actually important to share them. Maggie, when we asked you the last question about your advice to the sector, you immediately said to hold the hope, as if it was like the most obvious thing, right? And you said, in your words, when people are lost, when people are worried, when people are stressed, and it looks like they have no future, they give up. And so I'm saying to them, it's okay for you to give up, but I'm going to hold the goodness and the kindness about you in my mind. And when you're ready and able to see those things again, I'll be here for you. So I will hold the hope, and that's what I mean. And oh goodness, those words literally made me tear up. And I remember my own experience moving to Australia and having to learn to navigate the mental health system on my own, on top of all the other systems, right? Like healthcare and education and finances and worrying about all those different things. And it really is stressful building your life on your own from scratch, especially if at the same time you have to battle your own mental illnesses. And in their interview, we talk about stigma, we talk about discrimination, and how it's against the law to discriminate against somebody because of their mental health. And Maggie also mentioned that it's time to stop blaming the individual and look at the systems that we live in. And this is actually where I thought about the settlement system, right? And how for newly arrived migrants and refugees, the settlement sector or settlement agencies are usually the first point of contact, and a lot of newly arrived migrants and refugees will visit their trusted settlement agency or settlement worker before they seek help from a mental health service. And I think that actually raises a lot of questions about what responsibility does that create for us as a sector, but also, are we ready to support our clients? Are we ready to have those open and safe conversations about mental health? Or perhaps are we sometimes avoiding talking about mental health because that makes us uncomfortable? Like, is it discomfort or perhaps lack of training or fear of getting it wrong, or something structural that prevents us from engaging? And I think another important thing to think about is that our sector is actually led by people with lived experience, and many settlement workers bring their own lived experience of migration, trauma, and mental health. And also, how does that then shape the way the sector engages with those conversations? Yeah. Anyways, just some final thoughts and reflections. I think there is so much more to talk about. Yeah, and I'm really looking forward to continuing those conversations. Let us know what you think. Thank you.